Good afternoon, everyone. I'm in Pattaya right now, in case you should know by now. But I was going to do this video on the balcony, but I'm on the second floor. The pool's right there. The pool's loaded. It's frickin' noisy. Everybody's running their AC. I turned mine off, but because I was outside. But it was just too noisy. So I'm doing it obviously in my room. But I just finished watching Chuck's No Time to Be Sad recent video. And he was reflecting on his 9 years in Thailand. And with that reflection came talk of the United States and their time in the trailer. And he said he had around 1,500 subs when they were traveling around in that travel trailer. And he's doing YouTube just for the heck of it, you know, to document their travels. Kind of like I started to just document so my family could see what I was doing back home, or what they could see back home what I was doing here. But then I realized that I subscribed to Chuck's channel when they were traveling in that trailer. So I've been subscribed and watching Chuck for over 9 years. And that's just like, okay, he's been here 9, so yeah, I've been moderating for that long, and or close to it, and then with him before that. So good man alive. Time stands still for no man, right? It's gonna pass no matter what you do. So live it. Don't piss it away. Segue. Speaking of piss, I came down to Pattaya for prostate surgery. You know, 62, pushing 63. Numbers show that 80% of males my age have an enlarged prostate. Some treated by medicine, some need further assistance, surgery of various types. So the timing was such that now was the time to do it. Holidays are coming up. I just got back from the States in October. You know, we were on a road trip. It's not like it's painful or anything like that. It's a pain in the ass, okay? You know, we're adults here, okay? You know, when you urinate, it's enlarged. Just look at the anatomy on the flipping internet, and you'll know. It gets larger and it squeezes on your urethra, your pee tube. So the straw gets smaller. Well, the flow gets smaller and it takes longer to drain your bladder. So it's really not a pain in the ass, but you know, pain in the neck, let's say. So it's frustrating. And then there's frequent urination in the evening. Not completely emptying your bladder. Okay, we don't need to get all graphic, but I had that surgery on Friday, and today is Monday. So I spent 2 nights in hospital, and which was supposed to be 1. And doc said, "Hey, you know, you have a catheter, right? It's going into a bag, and I'm seeing too much blood. I want to have you overnight, another night." And I'm like, "Doc, okay, there's a fireworks festival coming, like now, to Pattaya. Big deal. And the jet ski championships, competition, whatever the hell you want to call it, right across from, on John Pitt Beach, across from the Wombat and Kiwi Bar from Steve's place, Steve and Oy's place. So it's a big ass weekend. You're gonna have firework, barges out in Pattaya Bay, out by the Hard Rock and in front of the Hilton and all that, and you can see them from everywhere, from Prostate to frickin' the Sanctuary of Truth. I mean, you can see frickin' fireworks. So everybody and their grandmother comes from Bangkok, from other places. It's a long weekend. And I didn't know that when I scheduled my frickin' surgery. So I booked my, okay, I'm gonna go here. He says it's gonna, he said, "I wanna have you here." I wanted to fly down and turn right around. I said this on another video, but in case you missed it. Okay, I'll fly down, and then when I get out of the hospital, I'll just fly back. And he said, no. I want you to stay a week for at least for your first follow-up. And I'm like going, I'm counting, I'm going, oh shit. All right, okay. And then he couldn't commit, or the nursing staff couldn't commit for him the 1 week. Now he told me such and such a day. So mentally I went, Doc told me this. But since the nurses couldn't confirm that, I added a couple days to it, for just in case. Fudge factor. Well, it turns out it's on the date that he said it would be, and I'm good to go. But I booked my first room, literally 5-minute walk at a snail's pace from Bangkok Hospital Pattaya, right? Part of the BDMS group. There's 6 groups that are combined around the nation, and there's a couple of them in Cambodia as well. All part of this massive group. And I could go into the quality of care and all that stuff. That's not the point of the video. So I had my surgery. I ended up staying 2 nights. Well, that second night put me into my checkout date on that first hotel to check into this hotel. And I'm like going, guy, I can't stay another night here because I got to check out of my hotel tomorrow. Are you gonna get me out of here before noon? Right? If you can't, here's their number, because I had already packed my bags, my new suitcase, which so far I like, and my backpack. I packed all that crap and left it in the room. The only thing I brought was my shoulder bag and my essentials. Medications, money. Right? I could lose all the other shit, wouldn't matter. computer, blah, blah, blah. It would not matter. I got my money and my meds. I can survive. So, but I left right as soon as you walk in the door of the other hotel. There's a nice little bench, a little lay down bench, and I had my suitcase all ready to go and my backpack ready to go. Everything was completely emptied out, except there were some M150s and a couple of lemonade, red lemonade, sugar-free, in the fridge. Mox Nicks, right? I didn't give a shit if that didn't come. But I said, okay, you're going to have to call the hospital, or not the hospital, the hotel, and say, A, late checkout, or B, grab his shit and bring it downstairs and put it in the lobby, prep the room for new customers, and then when we release him, he'll turn in his card key and he'll get his deposit back for the card key, or key card, however you want to call it. And so he pointed to the nurse. She nods, okay. So I had it all programmed to my phone. Here you go. Right? The number. You're not calling from my phone. I want it coming from the hospital, right? So that was all prearranged. But it turned out that he pushed it for me. Day one, I'm not in my room now. I've moved to the recovery room where I'm going to come after surgery. I'm right there waiting for them to come. And all the disciplines, you know, the anesthesiologist, the tech for the machine, the surgeon, the head nurse, Nurse Ratchet. No, just kidding. Just wonderful lady. And then a couple more that were assigned to my team, right? They all came to see me, and they all double and triple checked frickin' everything, right? I mean, they had barcode scanner, you know, on my wrist, right? They'd come and check my blood pressure and then go deep, machine deep, and it would register. And I'm saying, like, am I expired yet? You know, is this fruit old? But then I went from there into the OR, and they got me on this one. I said, because I always, I've had so many surgeries that you never know if you're coming out or not. The older you get, or the heavier you are, the harder it is on them to keep you alive. They just want you under. They don't want you frickin' deep out, right? These things happen. Bad things can happen. So she starts giving the, okay, take deep breaths, and I see her off to my left giving me the jab in the arm, in the IV tube. I said, you're going to tell me, right? Because I like to take my mask down by like this and say, thank you. All right? I don't go 199.98. I always say, thank you, everyone, for helping me. And then next thing I know, I'm waking up in recovery. But she got me. God dang it. She says, okay, take some deep breaths now. Deep breaths. We want lots of oxygen. Deep breaths now. Deep breaths. And I'm going, you're not going to tell me, are you? And next thing you know, I'm waking up in recovery. It's like, damn it. Because it's part of my tradition. Because I've had so many bloody surgeries, right? I don't even want to start pointing them out, counting them. They asked me, have I had surgeries? And have you had surgery before? And I laugh. I'm like, God, I can't count that high. Jeez Louise. So anyway, he said, I'll see you at 6 in the morning because I'm going to Bangkok. This is before my surgery. He says, all right. Okay, are you ready? Yeah, we're good to go. All right. Fist pump, right? We're good to go. All right. Because I know the surgeon personally. Yeah, I trust him. Obviously with my life. Well, actually it's mostly the anesthesiologist. But if shit goes wrong downstairs, it's my life. It's my life an hour now. Anyway, we don't need to be doing Bon Jovi. Coffee. Anesthesiologists don't get the credit they deserve. And this one was phenomenal. I mean phenomenal. In Thai terms, she was an elderly lady. She was probably my age. And extremely thorough. She asked me about everything. I mean, you know, she wanted my address, my phone number, how much money I had in the bank. You know, I'm just kidding. But no, completely professional. From down to the guy mopping up my muck, right? Top shelf. I can't say enough about them. They've operated on me twice, okay? Not that team. Well, 3 times now. Sorry. I'm getting old. Because 2 years ago I had a prostate procedure. We'll get into that another time. But anyway. So he said he'd see me at 6 in the morning. At 6:30 in the morning he came in, checked on me. And they discussed, he and the head nurse discussed the bag down there on the hanging below the bed. You know, and I don't understand what the hell they're saying, but I get the gist that I'm not going to hear what I want to hear, right? And he says, I think I want you to stay one more night. And that's when the discussion came about the room. Finally, I said, okay, all right. You know, what are you going to do, right? Pout, jump up and down, piss and moan. No. You just deal with it. But 3 hours later, my urine was clear. So I'm like, hey, it's clear now, man. It's clear. Call the doc. Call the doc. Call the doctor. Because I want to get out of here. I want to get out of here. I'm ready. I'm ready. She said, no. Doctor said no. And then the other surgeon attending that was there came in. How you feeling, Mitch? Blah, 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 blah. And really nice lady. And professional, but nice. Good bedside manner. Okay. And she had a resident tag along with her. Oh, wow, your urine's clear. Yes, yeah. So I can get out today? And she said, oh, yeah, undoubtedly. And then you know where the rank and file is, man. The head nurse went, blah, 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 and she went, oh, sorry. Number 1 said no. One more night. And I said, I understand. I had to try. I said, I had to try. And she walked out, and I said, I'm going to hound you to death, man. But, so I got out the next day, get to my hotel with plenty of time to check out. Main thing is I'm not supposed to lift anything or do anything strenuous, right? Just sitting up or getting out of bed is considered strenuous. Thank God I don't have these like low beds, you know. But I had my backpack on the handle of my suitcase. The strap was on the handle, and then I had a D-ring, so it was D-ringed to itself, to the carrying strap for the backpack, and I just tipped it and rolled it. So I'm carrying like 5 pounds maybe, right? But I'm okay. I check out, and I said this before in another video that you will have already seen, but I had a stack of 20s in my breast pocket. Hey, can you give me a hand with this? Boom, tip, boom, tip, 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 right? Tip is not a city in China. I tip, and I don't give a shit if people think you shouldn't tip.